Hi, I'm Dr. Kevin Augustine for the Fast Pain and Relief Center on Grand Island, New York. I want to welcome you to our carpal tunnel symptom website. You know, if you've had carpal tunnel syndrome, then you are in the right place. Number one, if you suffered from carpal tunnel, you know how debilitating it can be. When you have CTS, carpal tunnel syndrome, you know how it can affect your hands. You know how it can affect numbness into your hands, as well as even grip strength. Maybe buttoning a shirt, writing with a pen. Those are some of the difficulties. And it's tough even if you have, particularly for people that work and use their hands for a living. Because it's taken away your function, taken away what you can do, in your life for your job. If you're like most people that I've seen with carpal tunnel syndrome, you've been to your primary doctor already, and he's probably prescribed some anti-inflammatories to take down or reduce the inflammation within your hands. For some people that works, if it's real minor. But for the majority of people, I can tell you that doesn't work. And at that point, you're usually sent to a specialist. Maybe it's a neurologist who does a nerve conduction study and tells you have a problem with maybe your median nerve, your ulnar nerve, and to you those are foreign terms. Who cares? I just want to fix my hand numbness. And I couldn't agree with you more. Who cares about the testing? What can you do for me? How can you relieve not only the pain but fix the problem? And that's what I do at my office, is we get to the root source or cause of the problem. For many of my patients, they've been through physical therapy as well. Doing all kinds of exercises, maybe paraffin dips, range of motion exercises, injections even into the nerves, whether it's into the wrist itself or into the elbow. And what many people experience from that, it gives you a little bit of relief for a little while, and then it comes back. But what most patients don't realize, and you can ask your doctor this, you can only get those cortisone injections 3 times in a year. And if you ever ask why, they'll tell you, because it damages the bones. It actually eats them away. Causes deterioration of the bones. That's why you can only get 3 a year. So if you're sick and tired of dealing with carpal tunnel symptoms, sick of taking medications, getting injections to no avail without any long-term relief of symptoms, I want to tell you there's still hope for you. One of the things that I do in my office, and I've been in practice for almost 13 years now, seeing a lot of cases with carpal tunnel, even people with bilateral carpal tunnel. How do you get that? We're going to talk about that in a minute. But again, being in practice that long, I'm able to see a lot of patients suffering from carpal tunnel syndrome. Again, some people we can help, some people we can't because they've simply let it go too long. Those are patients that need potentially surgery. Those are ones that potentially have to stay on medications for the rest of their life or have to take a different job that's less active. But I can tell you the number one cause of carpal tunnel syndrome that I see in my office is from a neck problem. And this often does not get checked out when you go to your doctor. And I don't know why, but here's why you have to look at the neck, the cervical spine, to find out if that may be a cause of your carpal tunnel syndrome. See, the nerves from the lower part of the neck are the nerves that come down into the shoulder, the elbow, the wrist, and into the hands. Now, if you're getting pain down in here, numbness down into the hands and fingers, yeah, I want to check out the hands and fingers and make sure things are going down there, but let's trace that up to where the source is, where it first exits the spine. Let's look at those nerves. Is there deterioration? Is there degeneration of the spine? Is there a disc herniation of that area? Well, if there is, there may be some hope. There may be some potential to help. If you can correct, again, the nerve, if there's a problem up in the neck area that's coming down into the wrist and into the hand even, guess what? The carpal tunnel syndrome most of the time goes away. Now you can also get what they call a crush syndrome down into the elbow as well, or even down into the wrist. But that's what we check out during a proper exam, and get some x-rays, some diagnostic films as well. So, if you've been suffering with carpal tunnel, you've been dealing with this a long time, if you've been to many specialists and are just plain frustrated, I'm going to do something for you. I want to help you. And here's what we're going to do. I'm going to give you 2 free visits into my office. And here's the reason why I do this. Number 1, to see if we can even help you. Number 2, so you can see what I'm all about. I'll give you a little kind of glimpse here with a video on the website, but I want you to check me out just as much as I interview and check you out. Are you committed to getting help as well? That's another factor. I only accept patients in my office that are committed to getting better. People that really want to just listen to what I have to say, and they do it. And those are the people that get better. If you're the type of person that likes to kind of take bits and pieces of what to do, then don't even bother making an appointment. Because it does take work, it does take time, and it's not something that's immediate. So if you're serious about getting rid of your carpal tunnel, and I want to help you out, check the link above for 2 free visits. And you can simply call us at 716-773-4707, or you can fill out the form right below with your name and some information where we can get you some more info on carpal tunnel. If you have any questions at all, I would certainly love to help you and answer those questions before you even come in. Whether that's by phone or by email, just simply call or email, and you will have an answer pretty quickly. That's one of the things that I take great pride in, is putting my patients first. I don't treat people like I'm any better than anybody else. I treat you with respect, and I give you the time that you deserve when you come into my office. You're not here for a quick 10-minute office visit. So if you're looking for a comprehensive evaluation to see if you can get rid of your carpal tunnel syndrome, then just call us, and I'd be happy to help. Again, I'm Dr. Kevin Augustine from the Fast Pain Relief Center here on Grand Island, New York, and I look forward to talking with you.